Hello, everybody. Welcome everybody to this introduction, EMT introduction class. I'm very happy that we made it with so many people finally. A couple of days ago it was still a little less, but now it's great that this interest came up. And yeah, we talked with Kerry a couple of weeks ago, and I said we need something new here. And I saw what he was doing, and so we talked, and that's how we planned very spontaneously this class today and the next one in December. This 1.5 hour class, 1 hour class on introducing EMT. And we're planning already, he will talk to you about it later, for the first fundamental class in January, end of January, and then we'll see how it goes on if interest is there that he could come back to Switzerland. So welcome, Kerry. Thank you very much that you were so flexible and very spontaneous to do this with us.
Thank you. It's in the middle of my day here, so I got patients on either side of this.
Okay,
All right.
okay.
So you can go ahead and spotlight me.
You
And
are
I
you are
am
spotted.
spotlight? Oh, I
Yep.
see you.
I'm
Okay.
just I'm still me too, but I'm gonna get away me,
That's
and
right.
I'll let you talk.
Perfect. All right. So welcome everyone. The this class, this introductory class, I kind of created it a few years ago. And the reason why I created it was a lot of people were interested in energetic manual therapy, but they really didn't know what it was. And they didn't know if they wanted to, you know, put aside a whole day or 3 days to take a class. So I thought I'd put together this 1 hour class that people can kind of see if they are interested in, do they want to do a little bit more. So I have a little question for you here. This is a question I usually ask when I'm teaching live. And the question is, what is your body really made of? So think about that for a minute. I remember I was in Romania and I asked the people this, and the hands come up. And normally when this happens, people usually start off with the obvious things. They're going to say, well, I'm made up of, muscles and bones and organs. So this is all solid stuff. And solid stuff makes up about probably 40% of your body. And then the hands go up again, and people say, oh, we're also made up of fluid. We are. We're made up of water, and it's found in different forms. And that probably makes up about 60 to 70% of our body. But then all of a sudden, people don't know what else to say. So, what we're going to get at in this course is we're going to talk about that your body is actually made up of energy. And we're going to give you some ideas. We're going to talk about a sort of a model that shows you how everything is broken down into this concept. So when you take a look at this, this is the human energy system. So if you were to Google what is energy, these are things that you would probably get. Now in here, the first one, these are Dantians. And Dantians, this is when I'm a doctor of Oriental medicine as well. And Dantians are the three deepest energy centers. We have one in the pelvis, one in the heart, and one in the head. So this could be energy as well. Most of you should be familiar with chakras, especially if you've studied with BodyTalk. The other thing you might be familiar with, I'm a doctor of Oriental medicine, is acupuncture meridians. And some of you may also be aware of auras. So I'm not going to really talk about any of those things tonight. I'm going to talk about what's in the center. And the center is called the human biomatrix. So that's what we're going to focus on. Now, so today's talk, this is what I'm going to focus on. I'm going to kind of break down what is this human biomatrix. I'm going to talk about what is EMT, that's energetic manual therapy. I'm also going to address, well, why learn it? I'm going to give you some case studies, some interesting ones, and to kind of pique your interest. Well, I could see myself doing that. And then I'm going to kind of take you on my specific EMT journey. How did I develop this? And then I'm going to do a demonstration. So I'm going to pick one of you. And then I'm going to do another demonstration where I'm going to get all of you together and you're going to do it on yourself. So by the end of tonight, you're going to see me do it. And also you're going to feel it on your body. And then we'll talk a little bit about what is the energetic manual therapy, roadmap. What's it all about? Okay. So we're going to talk about this human biomatrix. Now, when you look at this, you have to start off with you as a totality. So when you look at your body, you are the human biomatrix. So what does that mean? Well, you could say that your body is made up of different systems. And you know that from if you studied BodyTalk, we have about 12 different systems. We have the musculoskeletal system. Do you have me spotlighted? Because I'm getting different people there.
Yes, I do.
Okay,
But maybe I didn't do it right.
I see everyone else but me.
No, I can see you. I can see the right image.
All right. Now, when we take a look at this,
Okay, now it's better, I think.
that's better. Now I see it because I was seeing myself in this little corner. Okay. So when we look at this human biomatrix, your body is made up of organ systems, and we've got 12 of them. We all know the musculoskeletal system, the urinary system, cardiovascular. Now, these organ systems are all made up of organs. Okay. Now, organs are basically just a collection of tissues, and it's a collection of tissues that have the same function. And when we break it down into tissues, we only really have four types of tissues. We have endothelial, that's your skin. And endothelial makes up the lining of your blood vessels. It makes up the inner walls of all your different cavities, your skin, all different things like that. The other tissues we have are muscle tissue, nerve tissue, and also connective tissue. Connective tissue would be like fascia, cartilage. Bone is considered connective tissue. So are arteries, veins, and lymphatics. So those are the four types of tissues that we have. Now, all those tissues are made up of cells. So a muscle cell is very different than a bone cell or a nerve cell. But all cells have the same common characteristics. Okay? They all have a nucleus. Okay? They all have different organelles inside them, the mitochondria, the ribosomes. Okay. They have all these different aspects, the endoplasmic reticulum. So it doesn't matter if you're a nerve cell, muscle cell, whatever, we all have a common aspect. All of this together is your biological structure. And this biological structure is where I spent most of my life. I'm a physical therapist, I'm an osteopath, I was an athletic trainer. So I worked with these various tissues. I worked with muscle tissues and fascial tissues. I worked with the cranial system, the visceral system. So I was very focused on tissues. Now, when I look back at my career, I wasn't able to help all my patients. There were several I could help, but others I couldn't because I saw everything as if it was a biological structure, because that's all I was taught. But what I want to do is I want to take it a little bit further because all of these biological structures, they're made up of finer things. So if we go a little bit further, we are made up of biomolecules. What are biomolecules? These are like fats, proteins, carbohydrates, vitamins, minerals. So all of these biomolecules are then made up of molecules. Molecules are made up of elements, and these are the elements from the periodic table. So we're made up of oxygen, carbon, hydrogen, nitrogen. And all of this is called our chemical structure. Okay. Now, we all know that if we eat the wrong food, we can feel it in our body. We can get a headache, we can get a stomach upset, something's not right in our body. My daughter Cassie, she would come to me when she was little. She would have headaches and neck pain. And she goes, Dad, can you work on me? And, me being the osteopath, I would go there and I would work on the cranial system. I'd work on her neck and I would do all these things. And she'd go, oh, that feels wonderful. But the problem kept coming back again and again because the real cause wasn't coming from her biological model. It was coming from her chemical structure. She was eating the wrong foods. We ended up doing blood tests and we found out that she was eating the wrong foods. She had some stress in her life. She was doing different things. And once we started to change some of the things that she was eating, all of a sudden these things started to disappear. Okay? That's why this chemical structure is so important to look at as well, because this could be the underlying root cause. right? Because you may know some people that once they change their diet or they took an herb or medication, all of a sudden that reduced their physical complaints. But we can take it a little bit further. All of these elements are made up of atoms, right? Single atoms. And when we break atoms down, atoms are not fundamental. They're made up of electrons or leptons. They're also made up of protons and neutrons inside the nucleus. So all of this together, right, is all the quantum structure. You could say that everything in your body, everything in the universe is made up of three things. It's made up of electrons, and it's made up of something called up quarks and down quarks, which are part of the protons and neutrons of the nucleus. If you were to take a look at, let's say, the human body is made up of about 30 trillion cells. Each cell could be like a muscle cell, bone cell, doesn't matter. Each cell has 100 trillion atoms. Your body's made up of primarily oxygen and carbon, hydrogen, nitrogen. Those are the main ones. Let's look at carbon, for example. So carbon has a nucleus and it has 6 protons and neutrons and it has 6 electrons around the field. If you were to give it a size, like a pearl from a pearl necklace, and if we were to place that in the middle of a big football stadium, the football stadium would be the electron field. See, when you see pictures of, these atoms, on in the internet, they're unrealistic because the center of it, the nucleus, is so small. That whole space is 99.9999999% empty space, but it's not empty space. It's energy. It's energy vibrating. So all of this together, right, makes up our body, makes up this human biomatrix. Okay? And one of the things that we need to look at, and I've been looking at probably the last 15 years, is where do we need to pay attention to for that particular patient or our own body? Do we need to focus on the biological structure or the chemical structure or the quantum structure? And one of the things that we have access to, if you, let's say, do something like BodyTalk, is you can ask the body. You can ask the body, what is the priority? Okay. Now, when you look at all that, you might say, well, there's some things that are missing there. What about thoughts? What about beliefs? What about emotions? What about consciousness? So let's try to put that together a little bit for you. So you remember the top-down causation. So we would put the physical body at the bottom. Everything is going to affect the physical body. But it's interesting that it's the physical body that I spend most of my time treating in my practice. People are coming in with neck pain, back pain, like my daughter, with headaches and neck pain. So we now know that this physical body has an energetic component. We broke it all down and it is made up of energy. We know that. But what else influences this energy body? We know it's your mind. We know your beliefs, your emotions also affect it. But what else can affect it? Well, your soul. Your soul is your consciousness. It's your awareness of who you are. And above that is going to be the spirit. This is kind of like the spark that gets everything going. So there is a downward causation of effect. So let's test this out a little bit. Let's get everybody to stand up for a second. So everybody stand up. Take your shoes off if you have them. And what I want you to do when you're standing up is I want you kind of just march on the spot and then just come to a spot and close your eyes. And I want you to kind of tune into your body. Be aware if you're weight bearing more on one foot or the other. Be aware if you have any tension in your body. Be aware if your pelvis seems balanced, your shoulders are level or unlevel. So just kind of tune in to how your body is today. And then what I want you to do, open your eyes for a second, is I want you to just evaluate a few things, like maybe lift your arm out sideways, do one side slowly, do the other one. I'm a little bit stiffer in the left one, but just get a baseline measurement of what they feel like. You can try bending your head forwards, to the first barrier and backwards. So I bend forwards easier. You can try rotating, okay, your head to the right and left. So I move easier to the right. Okay. You could even try your whole spine. You could kind of bend sideways to one side than the other. So I move easier to the right than the left. You can also try rotating your body. Good. I definitely rotate easier to the right. So I just get a baseline. And what I want you to do right now is I want you to close your eyes and still stay standing. And I want you to remember a time in your life that was very difficult for you. A time in your life that you may have failed at something. Or maybe you were in an incredible relationship and it ended. Or maybe it was a family member who you really cared for that's no longer here. But I want you to kind of pull up a memory, a key memory, and I want you to use all your senses. So I want you to close your eyes and I want you to see it. Either you're in the picture or you're looking out of your eyes, whatever comes natural. So I want you to see the image and I want you to feel it in your body. Where do you feel it in your body? And I'm going to ask you some questions about it. So as you get this image in your mind, are you in the picture or are you looking out of your eyes? Is it a still picture or is it a movie? And where is the picture? Is it in front of you? Is it to the left or to the right? Is it above or below? And how close is the picture to you or far away? So really tune into it. Is it black and white or is it colorful? Is it clear or is it fuzzy? And what do you feel in your body when you see this image or this movie? And where do you feel it in your body? And what I want you to do with your eyes closed, use all your senses, really get back into that. And right away, I'm doing it as I'm walking you through it, and I feel like my legs are heavier. And I feel like my right leg is even heavier than the left. So tune into your posture first. I feel like I'm side bent a little bit more just thinking about this. And then what I want you to do is I want you to reevaluate your movements. So right away, my right arm was moving better, but now it's stiffer. And my left arm is even stiffer. I feel like there's a weight on it. I feel more tension in it. I could also side bend. I moved easier to the right, and I still move easier to the right, but both sides are a little bit more restricted. Okay. And when I rotate to the right and the left, still I move better to the right, but both are more restricted. I can do my head movements. So extension is more limited. So this image didn't affect my neck as much. It affected my shoulders quite a bit, and it affected my torso quite a bit. So where did it affect your body? And the key thing I want you to think about is that all we did was to get you to bring up a thought, a memory, an emotion. And I want you to see how that trickles down and affects your physical body. All right, so go ahead and shake your body out. Shake your body out. Good. All right, so this time, here's what I want you to do. I want you to close your eyes again. And I want you to remember a time in your life that was extremely happy for you. For me, I always remember walking one of my daughters down the aisle when they got married, or the birth of my grandchildren or children. It could be your wedding day. It could be the day you got divorced. It could be the day you graduated at university or something, or started your own practice. So pick one. Pick something that makes you smile, makes you laugh. It's very light. Maybe you're proud of something. My daughter just graduated from a program, and I can just see her beaming, and I love it, watching her being successful. So I'm going to think of that. So close your eyes, and we're going to do that. We're going to do exactly the same thing. So see if I want you to use all your five senses and really be there. I'm going to ask you the same questions and see if they're a bit different. So are you in the picture or are you looking out of your eyes? How close or far away is that picture? And where is it? It can be in a different location. Is it left? Is it right? Is it above or below? Is it black and white or colorful? Is it a still or is it a moving picture? Okay. And what do you feel in your body? And what thoughts and emotions pop up in your mind as you look at this? And start to tune in to your posture. As soon as I tune in my posture is becoming more balanced. I can feel it. My shoulders are more level. My posture is more level. And I'm going to try moving my arm. Oh, this arm moves easier on the right. So go ahead and reevaluate. Even my left arm moves easier. I'm going to try side bending. Good. Actually, that feels easier on both sides. I'm going to try rotating. That's easier on both sides. Do the flexion, extension. You can see my extension is better. Yeah, definitely easier. And my rotation, okay, that's much easier. And see what it's like for you. So the key thing here is that our physical body is being influenced by our thoughts, our emotions, our consciousness. And we know that. But that's a nice physical way for you to see that. All right, and grab a seat. Now, so what is energetic manual therapy? I would say that it's an advanced manual therapy, and it combines a few things: energy medicine, quantum physics, and my understanding of manual therapy. Because everything I do with manual therapy, I can do with energy medicine. And my focus is to restore balance in the energetic blueprint that we call the human biomatrix. So that's what we talked about here. So my focus is to use those resources to balance this human biomatrix, okay, specifically. Okay. So why learn this technique? This technique is for those patients that go from doctor to doctor. They go from therapist to therapist. These are the people that are over medicated. These are the people that have failed surgeries, that don't respond as well. And I'm going to give you a couple of examples. So here's one. This is actually my grandson. This is Hudson. So this was 2 years ago. When my daughter-in-law, she wanted to have the baby at home. Luckily, she was smart enough and she realized that things weren't working out, and they got her to the hospital as soon as they can. When Hudson was born, he wasn't breathing. His heart wasn't beating, and they had to do CPR. They had to intubate him, and it was, you can see the distress that's in him. And he got great care. I mean, he got wonderful care. And they told me about this, but they wouldn't accept any visitors. It was just the parents. But because I know BodyTalk, because I know this energetic manual therapy, there were things that I could do right away for this child. And the other thing I believe in as well is collective consciousness. I sent emails out to all my students, all my friends, anybody that does energy medicine. Florence, I would have sent you an email if I would have known you at the time. And I think everybody, they didn't know who he was, but they either said a prayer for him, they were thinking about him, they would maybe do something. But what was incredible is that after about 3 days, look at the difference in his face and his body. Look at peace he is. When I was teaching in Tokyo, there was a couple of neonatal nurses there, and they go, "How many days was that?" And they go, "That's incredible," because usually those babies are there for like 1 to 2 weeks. He was discharged. I think they discharged him after the fifth day because it fell on a weekend, and they had to wait till the first of the week. But you can see the difference in his face. And here they are. That's my son and my daughter-in-law. You can see the baby smiling too. That's when they left. So, that's one of the reasons why I'm grateful I know these techniques, because I could do something right away. And I was at the hospital as well, and I got to hold the baby, and I got to actually work physically with the baby as well. But you can do all this from a distance. There he is today. This was just taken a little while ago. And so he's 2 years old now. Very alert baby, very alert. Now, here's another patient of mine. She actually works with me. She's one of my physical therapists. She's an incredible woman. I think she's in her 50s, and she competes in cross-country running, jumping, all track and field events. And she does the Masters event. Well, she's been training all year for the Worlds. And then when she was doing the hurdles, she ended up tripping over one of them and she landed on her right wrist. And what happened was she broke that wrist. Okay, she fractured it. And then what happened was they had to put in these plates and screws. And this is like, I would say, a week and a half before she has to compete. I mean, this woman is just incredible. She's just incredible, the amount of passion that she has inside of her. But here she is there. You can see the cast on her left arm. But what I want to remind you is that this metal, these screws are made up of what? They're made up of energy. Just like her muscles, her bones, and her joints, those things are made up of energy as well. So what I did is I worked with each of the screws and the bone and the plates, just balancing to her body, making it, support her, but also that her body was more comfortable with it. So this is her at one of the first events. There she goes. And here she is in the long jump. You can see the cast on her left wrist. Here she is doing shot put. Okay. And here she is with all her medals. And that's here at my clinic. So I was able to help her. And she was just so excited afterwards that she could compete. She thought all those years of training she wouldn't be able to compete, but she was able to. Now here are two people. They both are complaining of headaches and neck pain. And if they went to the doctor would say, hey, you need to treat this neck. You need to treat, the head. Just like my daughter, Cassie. But hers wasn't mechanical. Remember, hers was more, her diet and things like that. So the guy, he's an accountant and he's very tall and he works off a laptop computer. So his was very local. His was very specific. Levator, scapula muscle, C3, C4 in the neck. And basically I just had to work those areas and change his ergonomics and he was fine. The woman was a bit different. This woman had 10 years of this neck pain. Let me go to the vibe board for a minute. Now, when we come over here, her key problem area is up here. But she had a car accident about 10 years ago. And what happened was they kind of filleted this left foot and ankle. She had 4 surgeries. So the fascia is a connective tissue that surrounds the whole body from head to toe, divides the body into compartments. It blends into bones and organs, everything. So she had a lot of tension in this leg. Her diaphragms, her transverse diaphragms, her thoracic inlet, her respiratory diaphragm, pelvic floor were all restricted. She also had issues with this arm, and this tension was going all the way up to her head. Okay? Now, when you get this person to lie on their back with their legs straight and their arms by their side, and I'm standing here at the head of the table, I tried to lift her head up and move it around. I could hardly move it because of all this tension in her body. Okay? But when I asked her to bend her left foot, her knee and foot, the other leg stayed straight, and I asked her to bend her left arm. As soon as I did that, what happened was we reduced the tension in these areas. All of this got much better. And what happened was I was able to move this neck anywhere I wanted to. So what happened here with this is that for 10 years, this patient was seeing chiropractors, physical therapists, acupuncturists, massage therapists. But what were they all doing? They were all working locally at the neck. But once you step back and you evaluate this person, you see that, and she had a car accident 10 years ago, that there's a lot more going on with the body. But one of the things that we teach you to do, just like in BodyTalk, is to dialogue with the body. Where's the problem? Is the problem a specific problem or is it more systemic? Her problem was more systemic. So one of the key things we do is you kind of define why is it you're coming to see me. For her, it was headaches and neck and pain. Then one of the key things we all face as practitioners is where do we treat? And then what do we treat? So these are questions we can ask. So for her, the where and what was that left foot. That left foot was the key. And we were able to work with this energetically. So when you have trauma is very interesting because our body is made up of energy and the car that hit her is made up of energy. And that car at rest has potential energy, but because it was moving fast, that's kinetic energy, that force gets transmitted into your body. Not only does it shear and tear, and it could, some people break their bones, some people tear things, they get bleeding, all those things. But remember what we just talked about with the quantum field, is there are fields of energy. These energetic fields also get distorted. And I found this out, on my own over the years, is that I studied so many different types of manual techniques. And when I would try to use them, some people would respond really well, but then other people wouldn't. And as I started to learn BodyTalk or learn these techniques, all of a sudden, those people there that didn't respond to the physical manual stuff were responding much better to this energy work. I remember when I was teaching in Germany, and it was wintertime, and a woman was walking. She was one of the students. She slipped and fell and landed on her butt. And so all the students brought her in. She goes, "Oh, you got to treat her." And I go, "I will." I said, "But," and I asked her permission. I said, "Can we use you, to as an example?" And she goes, "Sure. Okay. Let's take a look at your body first. I will treat you," I told her. So I lie her down and we start to lift her legs, and her legs were starting to get a little bit tighter. Her pelvis was getting tighter, her diaphragm, everything, but it wasn't too bad. But I said, let's just let it wait, let it wait. And what happens is that when you get that impact, let's say it was on her sacrum, it started to ripple like when you put a pebble in the pond, and it started to ripple through her body. And then an hour later, I could hardly move her legs because that force started to spread throughout the body and lock down not the tissues, but the electromagnetic forces, because the energy, or sorry, the muscles are all made up of electromagnetic fields. So are the bones, so are the joints. And now they were all disturbed. So now I said, okay, now I'm going to treat it. And I treated the impact where the energy came in, and we did it's called a vector release. So we did that, and we did a few other things. And as soon as we did that, immediately did we see a change in her physical body. And that's what I did with this woman here. Same thing. But this thing happened 10 years ago, but it was still there because nobody released it. So what I found is it's not that I don't do any orthopedic manual therapy anymore. I do. But now I do both. I do integrated manual therapy. I use BodyTalk, I use energy work, I use manual therapy. I use what the patient needs because we're made up of all these things. I also advise on what? I advise on herbal stuff because I'm a doctor of into medicine, diet, exercise, all those things. Because all these things have an effect on our body. So when you take a look at this case, you can have two people that both have neck problems, but you can see that the accountant was very different. His was all local, but with her, it was more complex throughout the whole body. So these are things that we all have difficulty. Where do we balance and what do we balance? But these are things that we can ask the body what to do. So what I want to do now is I want to talk a little bit about how I developed this. So that's me actually. That's me when I was about 22 years of age, number 35. I'm from Canada originally, and I played American football. And it's funny that when you're in your 20s, you think that your body's invincible, right? I thought mine was, but it wasn't. I got injured. I got lots of injuries. And what happened is they would basically put me into ice cold whirlpool tanks. They would ultrasound me. They would put electrical stim on me. They would massage me. They would teach me stretches. And I found that these techniques did work to a certain point, but every time I was back on the field trying to run or change directions, I kept saying, "You're missing something." And they kept doing these same things to me again and again. And I was getting so frustrated. I kind of saw that, my future as a football player was limited. So I decided I'd become an athletic therapist. And it was in that same school, University of Western. This is in London, Ontario, Canada. And so as an athletic trainer or therapist, I got to work on a lot of athletes and acute injuries. So I got a lot of good experience. I worked on the football team, hockey team, all sorts of different things. It was great experience. The only problem is I gave them the same treatments that they gave me. And sometimes it worked, a lot of times it didn't work. So I was hungry for knowledge, and I ended up going to University of Toronto, and I studied physical therapy. It was one of the best things I ever did because I met one of my first mentors there. His name was Doug Freer, and he started to introduce to me manual therapy. And as a student, I started to study this, and I started to study it when I graduated. I learned over 300 different techniques. I would study visceral manipulation, cranial sacral therapy, things called strain counter strain, muscle energy, myofascial release. These are all kind of osteopathic techniques. And what I realized for me is that it wasn't one approach that helped me. It was a combination of all these different approaches. Because anytime you take a class, if you've taken classes, you work on each other. And I found that after every class that I got my body worked on, it was getting better. But it wasn't one thing, it was like an integration because each of these techniques worked on a different thing. Some worked on fascia of the cranium, of the viscera, of the muscles. Some worked on muscles, some worked on joints, some worked on lymphatics, all different things, as we went along. And so when I opened my own practice, I remember a patient came in with low back pain and I didn't know what to do. I had too many techniques in my head. I learned all these techniques from everybody, but nobody taught me when to use this technique or when to use that technique. And this is when I went back to osteopathic school. And I went to two schools actually. I went to one in Canada where I'm from, and also England. I studied with a guy over here. His name's John Wernham. Now, what I loved about osteopathic school was that they didn't believe in techniques. They believed in anatomy and physiology. They believed in evaluation. They would give you terms like the rule of the artery is supreme, right? So for example, if we go back to this vibe board, clean this up. Let's say you come in and you have a knee problem. They would say, well, how does a knee heal? Well, a knee heals by blood supply, carrying oxygen and nutrition. But in order for it to heal, you got to get rid of the waste products through the venous system and the lymphatic system. The other thing that's important is the nervous system, the brain, the spinal cord, and the nerves. Now, I add the meridian system to this, but this is what they would do. And they would say the rule of the artery is supreme. So there is a pathway, right, that goes from the heart to the knee and back, and there's a pathway here from the brain to the knee. And then they would say, well, what can interfere with this pathway? Well, there's lots of things. Those diaphragms we talked about, right? Lines of fascial tension, all sorts of different things. So they would say that the role of manual therapy is to create a better environment for healing. I love that. And they didn't want you memorizing techniques. They wanted you to understand techniques. And you could invent your, because I'm a big guy, and there's a woman who's smaller than me. We can both treat the same thing, but have our own style. So there wasn't one set way of doing things. So I just fell in love with osteopathy. But like anything else, it wasn't enough. I was helping a lot of my patients, but we're always pushed by those people that don't get better. So the next thing I did is I became a doctor of oriental medicine. I studied acupuncture. It was like a 4-year program. And while I was here, I met this guy, John Veltheim. This was in Sarasota, Florida. And he introduced to me a concept called BodyTalk. Some of you may be familiar with that. And this is when BodyTalk just started. This was back in the late 90s in Sarasota. And I was in his second ever BodyTalk class that was in the States. And I thought it was very strange, and I didn't jump into it right away. And what I found myself doing, and it took me probably a good 2 years to really understand it because I was very left brain and I had all this information in my head. But I knew something was there because John used to I used to get so frustrated with him because I'd be in class and I try to challenge him. I go, John, this person's got a shoulder problem. And he goes, Kerry, it's easy. Just do the reciprocal. And he would put a hand on the clavicle, and then he'd come on to the opposite side. He'd tap it out, and all of a sudden the person's arm would move. And it just used to infuriate me. I go, you're making this so easy. And so I started to work with it. And I guess I was a bit stubborn as well. But what I found was evaluation was my saving grace. Is I would do an evaluation before and after the BodyTalk session. And I started to really see how powerful BodyTalk was. And then John said, because I taught his class for this orthopedic class for one of the conventions. And this orthopedic class I taught for body talkers, I still teach it, is it teaches body talkers how to evaluate because energy medicine is so subtle. And I would evaluate before and after, and you could see the incredible changes as a result of that. So I started to get people all over the world asking me to teach this class. I went to Australia, Europe, Tokyo, all over the place. And when I was in Germany, I was teaching this class, and one of the girls comes up to me and she says, do you mind looking at my neck? And I go, yeah, what's going on? She goes, I've been having this headache and neck pain. So I evaluate her and I said, you need some craniosacral therapy. And she goes, I've already had that. The problem is if you get craniosacral therapy, depending on who's giving it to you, they do a protocol, right? They treat everybody the same way. And I told her, I said, you need a body talker, right? Someone who asks the body and dialogues with the body to do your cranial work. And she goes, well, you do. Can you treat me? And I go, yeah, I'll treat you. And then I treated her and I was able to get rid of her problem. And she goes, that was really cool. You should develop a class in that. So I did. And the class was BodyTalk fascial balancing. And what I did in this class is I would use BodyTalk. BodyTalk teaches you to ask yes and no through a biofeedback test, find a priority. But I was hinging it all on doing fascial work, like cranial, visceral, myofascia. And so I was using that to decide where we're going to treat, just like I treated that woman with her headaches and neck pain. I used the priority asking biofeedback test to decide where we were, but I still treated her with my hands on the body. And that's what I saw in my football brain, right? That's how I was seeing the class. So while I was teaching this class in North Carolina, it was the end of day one, and a bunch of the women came up to me and they said, "We really loving your class, but can you do this off the body?" And I go, "Yeah, why not?" And they go, "Show us." I'd never done it before off the body. And one of the chiropractors in the class, Dr. Lord, he had a bad right hip. And he goes, use my body as a demo. And we had a Belgian physical therapist there, and he says, and I'll evaluate. And I go, oh, crap. So when I evaluated Dr. Lord's hip, he had very little movement. I had other people come by and feel it. It was stuck. Now, I had, in BodyTalk, I had studied a technique called Mindscape. And when I was standing there in front of Dr. Lord, I started to look at him. I didn't panic. I just was there. And then I cleared my mind. And all of a sudden in my mind, I saw the hip bone. I saw the neck of the femur, which is, right here. I didn't see muscles. I didn't see an organ. I saw that specifically. And then what I did is, because I'm a manual therapist, is I went in there and I grabbed that bone and I started to observe it. And one of the techniques that I teach and we did is unwinding, where we would do like a fascial unwinding. And it probably was that. So in the beginning, it was a combination of mindscape, fascia work, unwinding, things like that. So I started to look at it and I felt my hands moving. They would come together, they would twist, they would do this, and all of a sudden this happened. And I said, oh, I guess we're done. And then we go back and measure again, and his whole hip had released. It was moving on all the different planes. And I go, that's how you do it. And they go, bullshit, what did you just do? I said, I have no idea, but I love it. And we stayed there till about midnight that night. And then we just started to play around with things. You guys, I think most of you know Tracy Clark. She was my coordinator at the time in Toronto. And I call her, I said, Tracy, I said, because she was bringing me there to teach this class. And I go, have you copied the manual yet? She goes, no, I was just about to. I go, don't, I'm going to change it. And she goes, what are you doing? I go, you'll see, because I still had to write it. So Tracy's class was the first class that I did this in Toronto, but it all started here in North Carolina. And so I changed the name because the name before was like a fascial balancing because we were doing it on the body. I changed the name to BodyTalk Fascial Energetics, but I still had the word fascia in it because in my mind, I thought we were working with fascia everywhere. But as this started to evolve, I realized that this technique can be done on anything. It can be done on fascia, on a bone, on a muscle, on a joint, an organ, a blood vessel, different parts of the brain, anything. It can be done, remember the lady who broke her wrist? It can be done on metal. It can be done on animals. It can be done on anyone. I don't know if you know Lucia. Lucia, she used to teach animal talk. And I went with her to Indonesia and we worked with, I think we worked with about 13 elephants. And then there was, I think, 7 islands filled with orangutans. We worked with orangutans, sun bears, but we tested this energy manual therapy out. It was incredible. And we made a really cool video about it. So it blends in very nicely with this technique, with BodyTalk especially. I love this quote. This is by Coach John Wooden. If you don't know John Wooden was a basketball coach for UCLA Bruins, so college basketball in USA. What's special about him is he won 11 national championships and he won 7 in a row. The closest person to him is a school that it's won 3. That's how incredible this guy was. Look at his quote. I've tried to live by this quote. It's what you learn after you know everything that counts. When I first met John Veltheim, I thought I knew everything. I had taken hundreds of classes. I was doing acupuncture. I was an osteopath, athletic therapist, and he was trying to teach me this. And at the time, I was dismissing it, but now it's probably one of the biggest things that I do, that I've incorporated into my, the rest of my techniques. So try to use this yourself. Is, when people, I really believe that people cross my path for a reason. And I try now, I was very grateful that John, crossed my path. And I look back at all the other incredible people who I call my masters, my people that have influenced me. And, do the same in your life. Who crosses your path and what do you do with it? What do you learn? Keep an open mind with all of this. So my background, for those that don't know me, is athletic therapist, physical therapist. I'm a doctor of oriental medicine, osteopath, and I've been involved in body talk since the late 90s. So I'm advanced CBI, CBP, senior practitioner for many years. And I've taught at many institutions. I have my own institution, the Dambrogio Institute, which teaches orthopedic and energetic manual therapy. And I also have taught at the Burrell Institute for many years. They teach visceral manipulation. And the Upledger Institute, they teach a lot of what we call craniosacral therapy. So what I want to do now is I just want to do a little bit of a demonstration. And I'm going to kind of go to gallery view. I'm just going to kind of pick someone. I kind of randomly pick someone. Let's see here. All right. Marika, can I use you?
Yes, sure.
Good. So we'll see if you can spotlight the two of us. And where are you? Are you in, so you've got me here. So see if you can spotlight her as well, the two of us together. So you can't let go of me. I wonder if I'm in. Okay. How are we doing there, Florence? If you go to her right and spotlight her, and
Yep.
then go to me and
Now it should be
spotlight
good.
me.
Now it should be good.
Now I just see you. All right, so here's what we're going to do is if you guys, let's go into gallery view.
Oh, here. No, that's good. Now.
Did you got it okay?
Yeah.
All right, let's see. Perfect.
Yeah.
Excellent. Okay, so here's what we're going to do. So I'm going to do a little demonstration with you. And the first thing I'm going to do is I'm going to go to this vibe board. And I'm going to get rid of this. And let's see. So I'm drawn to this part of your body. That's the part of the body that I'm going to work with. That's where I'm drawn to. And what I want to do is I want to do an evaluation of you. I'm going to get, can you stand up at all?
Mm-hmm.
And I'm going to put this on here and I'm going to draw on here. And all we have to do is be able to hear you. So I want your feedback. That's perfect. I want you to march on the spot and then come to a stop and then just close your eyes. And there's no right or wrong answer. It's just what you feel. Are you weight bearing more on one foot or the other? Or do they seem equal to you?
It's equal.
Okay, so I'm going to put a little check mark here. What I want you to do is I want you to tune into both your legs and see, do they feel the same? I want you to tune into tension. I want you to feel any asymmetries. Like you might feel one knee is bent, one is straightened. Maybe your pelvis is rotated or shifted left or right. Just tune into your legs. Do they feel identical or is there any difference that you feel?
The left knee is straight and
Okay.
the right is a little bit bent.
Right is bent, okay.
And like the pelvis is a little bit rotated.
To your right. To your right. Okay,
yes.
good.
Yeah.
You're doing good. Do you feel any tension anywhere or do you just feel these asymmetries?
Tension in the left leg.
Whereabouts in the left? The front, the back, the side?
The front, more on the upper side.
Upper thigh, okay. So I'm going to shade this in here like this, okay. Anything else in the legs?
I feel a little bit weak now in the legs.
They feel weak?
Yeah.
Okay, I'm going to write that down here. Good, all right. Anything else with your pelvis or legs?
No.
Okay, good. I want you now to tune into your belly and your chest and maybe take a big breath in and be aware of any tension there, or if you feel any rotation in your torso or side bending, just be aware of anything that you feel there.
Yeah, the belly always feels like it's moving forward.
Okay.
And so the back is moving the other side. So
Okay.
yeah.
So do you feel like your back is arched or?
Yeah. Like so this is front and this is.
Oh, I got you. I got you. I'll do that. Okay. Do you feel anything in your chest at all? Maybe take a big breath in. What do you feel in your chest?
Very
Tight?
close, tight, close.
Okay.
Yeah.
You're doing good. You're doing good. All right. Now I want you to tune into your arms. Does one shoulder feel lower than the other, maybe more forward than the other? Things to look at is if one arm feels closer to the body than the other, or if it's rotated. Just tune into both arms and see if they're the same or different.
The left arm is a little bit down,
Okay.
and I feel like rotated more
Inwards.
forward.
Okay. Yep.
Forward. Yeah. And the right is moving backwards. And like the right arm is a little bit bent in the elbow.
Right arm is bent. Okay. Good. Anything else with the arms?
Like the left hand is straight and the right
I see that. Yeah, I see that. Yeah.
Yeah.
Well, that's straight. This is bent. All right. Now tune into your head and neck and be aware if your head feels like it's pulled forwards or backwards, or it's rotated to the left or right. See what you feel.
It feels like it's falling down.
Okay.
Yeah.
Does it feel like it's rotated left or right, or side bent left or right?
It always feels like it's not on the rest of the part of the body.
It doesn't feel like it's connected.
Yeah, it's like it's loose.
All right. Now tune into the back, like your thoracic and lumbar pelvis, kind of go down your back. Is there any tension or anything get your thought process there? Any rotations or side bending or tension?
On the left side, the iliosacral.
Yep.
It's much tension.
Okay.
Mm.
Anywhere else?
Only on the lower back, you mean?
In your back or your thoracic, between your shoulder blades, anywhere down your back.
Yeah, it's in the middle on the shoulder blades. It's
in between the shoulder blades?
Yeah.
Okay, good.
More on the left, more on the left.
More on the left. Okay, good. All right, now open your eyes and just take a look at what I've drawn and see if that's pretty accurate for you, and if there's anything else that you want to add to that.
The head, like there's always tension in the eyes.
I gotcha. Okay.
And there's much pain from the back straight through through the eyes.
Okay.
Yeah.
All right. Anything else?
Sometimes I have the feeling that my the
But do you feel it? Do you feel it now? Do you feel it now?
No.
Okay. Yeah, just what you feel right now in this moment.
Yeah.
Okay. So here's what we're going to do. That's postural evaluation. So now we're going to do range of motion. We're going to do a couple of movements. Okay. So you can stand up again. Now, the area that I'm looking at is right here in black. That's the area that I'm going to treat. So one of the things that we could evaluate for you as you're standing there, you could bend to the right, pause, then come back up, and then go to the left. Does one direction move easier than the other?
Yeah, to the left it's easier than to the right.
Okay, so we have thoracic. This is side flexion. Left is greater than right. Okay, good. Now, the other thing you can do while you're standing there is you can rotate your body, let's say to the right, pause, and then rotate to the left. Does that feel the same on both sides, or is one move easier than the other?
Right is restricted, left is easier.
Left is easier, okay? I tend to write down whichever is easiest. And the last thing I want you to do with that area is I want you to go sideways and just bend to the floor and bend backwards and just notice if one of those movements is easier.
Yeah. Down is easier.
Down is easier? Okay. Well, that's good. And let's just do a couple of neck movements and then that'll be it. So with your neck, I want you to bend your head forwards and then backwards and just see what's easier there.
Forward. It's easier.
Flexion and extension. All right. Then the other thing I want you to do is just turn your head to the right, pause, and then to the left, which is easier.
Left is easier.
Okay. And then the last thing I want you to do is you can do side bending to the right and side bending to the left.
The same.
Does it feel loose or tight on both sides?
Tight both sides.
Okay. All right. Good. So we've got enough things there. Okay. So the reason why you can stand there for a second. The reason why we evaluate is not to diagnose, but to show change. What I'm going to do when I treat you is I'm going to focus on where you see that red circle and the star in between it, because that's where your body said that's our focus. So what I'm going to do is I'm going to have my hands, they're going to be anterior, posterior in that area. And what I'm doing in this first level class is I'm not going to be focused so much on a specific organ or a bone or a joint. I'm going to be focused just on the area. There's lots of ways that we can do this, but right now I'm just going to be focused on that area, which means I can affect multiple bits of anatomy all at the same time. Okay. All I want you to do is I want you with your left hand just to tap over your heart and just breathe normally. So I'm going to tune into that area and just breathe in and out and tap. There we go. That's it. Now I want you to tap your head, your heart, and your belly. So I had my hands anterior and posterior, but I'm also going to do one more, and I'm going to go medial lateral. So my hands are going to be kind of, instead of front and back, they're going to be left and right on that area. And I'm just going to have you breathe in and out and tap. That's it. There it goes. Tap your head, heart, and belly. Okay. Good. Okay, I want you standing up, march on the spot again. And what I want you to do is close your eyes, and I'm going to ask you questions. So last time you said both legs were fairly even, but you did feel that your left pelvis was rotated to the right and you felt tension in your left quadricep and you felt weakness in your legs. What do you feel in your legs?
They are more at the ground and yeah, it has more strength, both legs.
Do you feel any rotation from left to right?
No.
Okay. You felt like your left knee was straight and your right knee was bent?
This is both are straight now.
Okay. And you also felt the tension in your left quadricep. What do you feel there?
Still a little bit, but not that much.
Okay. So I'm going to put, there's still a little bit there. Now let's tune in to your chest. You felt a lot of tightness in your chest.
Yeah, breathing is lighter.
Okay.
There's some tension around here.
Okay, so there's a little bit of tension there. You also notice that your left arm was, oh, I noticed your hands are both open. So that's the next question. You notice that you felt like your left arm was longer and it was rotated inwards, and the right arm was rotated outwards. What do you notice with your arms?
Now they are in one line.
Okay.
And yeah,
What about the tension in your forehead?
lighter, but still a little bit.
Still a little bit there. Okay, so it's down, but it's a little bit. You also felt this tension from the back of your neck coming forward to your head. What do you feel there?
More at the front, not that much at in the back.
Okay, it's better. You felt like your head was forward. Does it still feel forward?
No, it's straight.
Good. And you felt tension between your shoulder blades more on your left side?
Yeah, it's getting better. Also, only a spot left.
Okay, just a little bit. How about your left sacroiliac?
It's good.
Good. And then you felt like your back was arched and your belly was forwards. What do you feel there?
Also, more in the middle.
Okay, good. Good. So when you take a look at this, you can open your eyes. A lot of this changed. There's a couple of little places, a little bit of your shoulder blade, a little bit of your left thigh, a little bit of your forehead. They're still there. But let's check some movements. Let's check your thoracic, your side bending. You said you were better side bending to your left than your right.
And both sides are now good.
All right. And then rotation, you felt rotation was better left than right.
Also good, both sides.
Good. And you felt bending forwards was better than extending.
Now it's also good at the back.
Yeah, I can see you're doing what that's better. Now try your neck movements. Try bending your head forwards and backwards. You felt flexion was better than extension.
Also better.
And then try rotation left and right.
Yeah.
Excellent. And then side bending, you felt it was kind of stuck both ways.
A little bit, but not that much.
Perfect. Good. So we got some nice changes there. Good. So that was just doing a very basic release, energetic release in an area of the body. In other class, this is just an intro to it. But as we go further into the classes, we get very specific so we can work on very specific anatomy. We can also tie in emotions or belief systems, all sorts of things. But thank you very much. Those are nice changes for you.
Thank you very much. Thank you very much. Yeah.
You're welcome. You're welcome. All right. So you can unspotlight her, Florence. And then what I want to do with you guys is I want to take everybody through this. So there's a 5-step process, and Florence is going to mail this to you. She's going to send you a video, and she's going to send you a PDF. There's one in English and one in German, whatever you want. If you want both, she'll send you both. And this is something that you can do every day just to kind of practice doing energetic balancing. So let's get everybody stand up. I'm going to walk you through this. And don't worry, you're going to get this in, you'll get a video of this. So take your shoes off. And what you're going to do is just kind of march on the spot and then come to a nice, comfortable place and relax. Okay, I'm going to do this with you. So I'm going to, this, okay. So what I want you to do is I want you just to close your eyes and just tune into your posture. I'm weight bearing more on my right leg. My right knee is extended, my left knee is flexed, and I feel like my pelvis is rotated to the right. So I'm just going to record it here for me. You tune into yourself. All right. And see if there's any tension in your body. So I feel like my spine is extended and I'm kind of rotated to the right. So my spine is extended and I'm definitely rotated to the right. And I feel like my right shoulder is lower than the left. I feel like my neck is extended as well. So I feel like everything is extended and it's kind of rotated to the right and a little bit side bent right. So a little bit side bent right. So once you tune into your posture, then what I want you to do is I want you to tune into your body and find an area of tension. So I'm going to pick an area of tension that I want to work on. Let's see what I'm going to do. I've got two areas of tension. I'm going to work on my right shoulder. So I'm going to work on my right shoulder. So I'm going to put a different color here. So my right shoulder, my other area is right here. I have two areas, both on the right side. And what I want you to do is I want you to locate that and give it a number of how tense it is. So for me, that my tension, probably a 5 out of 10. So I can put like a 5 out of 10 here. Okay. Now, now I know that it's the tension of my shoulder, I can really tune in. I like to do an evaluation of my posture. And then once I find the spot, I can really feel that. I feel like that right shoulder is lower. I'm rotated that way. So I really feel that and I'm extended. So I feel that. Now, another thing that you can do is you can do a self-evaluation. So if your tension is in your neck, you could evaluate, the neck movement and rotation. If your tension was in your torso, you could do what we did. You could bend forwards or backwards. You could side bend. And why do we evaluate? Not so much to diagnose, but just to measure change. You could rotate. Mine's in my shoulder, so I'm going to evaluate. And I can evaluate flexion. It's funny that I feel it there because I usually have left shoulder problems more, but I feel it over here today, so I'm going to go with that. All right, so I did some shoulder movements, and I'm just going to do some, it's easier for me to go to the right than the left. Rotation's easier right than left, and my body likes extension, all right? So I've done enough of this. So when we look at all this, it's tuning into your body, finding an area of tension, and self-evaluating. And you can evaluate through posture or range of motion. Now what we're going to do is observe the energetic lesion. So my lesion is back here. I'm going to take it out and I'm going to place it between my hands. My elbows are by my side. My elbows are at 90 degrees. So I've just taken that tension in my right shoulder and I'm placing it between my hands. So everybody grab an area of tension, place it between your hands, close your eyes, and just observe it. Don't try to give it a label like it's a bone or muscle. Just it's an area of tension. And first of all, how big is it? Mine's like a bowling ball or bigger than a bowling ball. Does it have a shape? Does it have a size? You can see this. Use your five senses. You can see it. I can feel it. Mine, it looks like it's a shape, a round shape. Yours could be square, triangle, could be irregular. Mine is smooth. Yours could be bumpy. They could be sticky, could be sharp. So mine's smooth. What color? Mine's kind of a dark and silvery color. Mine's heavy. So it feels heavy. Kind of like a ball and chain kind of deal. And you can try to compress it. Mine can't be compressed. Just observing it. And just be aware of the size, the shape, the texture, the weight, the color. Okay, try to see it, try to feel it, and then be aware of any thoughts or emotions. So as I just begin just to observe this and just allow anything to come up. I pick up some sadness. So there's a little bit of sadness there. So I'm just tuning into that. And we're getting, oh, it's funny. I was even thinking about that. My dad passed away around this time. It's been a few years ago, but I'm starting to get an image of him and you know, what he meant to me. And as I start to do this, my hand is starting to move. Your hand doesn't have to move. You're just observing the energy. You just observe it. And if you feel that there's motion, go with it. If there's no motion, that's fine. And just observe the energy and breathe. When I find that mine's getting a little smaller and it's changing shape, it's coming together. And I'm just observing it. Just observing it. It's coming together, and then it's gone. And at the end of it, you can tap your head for a breath. Tap over your heart for a breath. And your belly for a breath. Good. And if you're still working, keep working. So I'm going to march on the spot. I'm going to tune into my body. So I'll go back to what I felt on the vibe board. I do not feel, I feel like both my knees are slightly bent. So I can make some changes here for me. I don't feel like I'm weight bearing on my right. These feel better. Let's see. I don't feel like I'm rotated here. I don't feel I'm rotated here. I don't feel like I'm side bent. I don't feel like I'm extended in my neck. Let's see if my spine. Nope, I don't feel extended there. And what's my tension like? I don't feel any tension there. I still feel, this feels better, but I still feel this one there that I could work on later if I wanted to. Okay. And we give you these forms that you can use in the foundations class. Okay. So if we go back to, if you're still working, so we tune into the body, we find an area of tension, you know, grade it on a scale from 0 to 10. Then you evaluate. We evaluate not so much to diagnose, but to measure change. Then we observe the lesion using our 5 senses. Then once it disperses, we can tap it in and we reevaluate. Okay. How did you guys do? Give me a thumbs up. Good, good. All right. Now, I want to show you a little bit of the energy manual therapy roadmap. So we have pre-practitioner training. That's what this is. So part of this training is we teach you energy manual therapy introduction. Okay. And that's what this is about. It's just a free introductory class. Just, you know, just to introduce some of the concepts, get you doing some work on yourself. And Vanessa's going to send you a video and a PDF so you can do it with your patients. You can, you know, play with it, see if you like it. The next level is foundations. And foundations, again, you know, people don't know if they want to invest more time in this. So it's a 1-day class. Sometimes we do it in 2 evenings. And this foundation class is a way for you to take a little bit deeper dive, learn to dialogue with the body, learn to use a protocol, learn to do what we did today in different parts on yourself and other people. And then once you've done that, you're going to have a good understanding whether this is for you or not. If it is for you, we have practitioner training. And we have energetic level manual therapy 1. And this is where we work with the musculoskeletal system. We work with cavities, the ventral cavity, that's where your organs are, the viscera and the fascial viscera around that, the dorsal cavity where your brain and spinal cord are, and the fascia there, which is the meningeal fascia. So we look at cavities, we look at the musculoskeletal system, we look at superficial and deep fascia. We do one location at a time. It's a fun course. And once you finish that, then we're into EMT2. EMT2 starts to get into the mind-body component. Is there a story there? Are there thoughts, beliefs, emotions, consciousness that are part of that? And then we have an advanced level class. This level gets you to deal with multiple locations, vectors, which are a line of tension that gets stuck in the body, fascial chains, combinations, and integrating mind body into a lot of these advanced techniques. And so that's the practitioner training. And then finally, we have an integrative practitioner training that's putting it all together and integrating it with other concepts. This level is by invitation only. And so here we tend to go away on retreats. We did one in North Carolina last year. We had a great time. And it was like 20 of us all together, eating meals together, going hiking together, doing trades on each other, lecturing. So it's people that are very serious about this. So that's our roadmap for this. What's next for you guys is this. So I've talked to Florence, and she wanted me to do a couple of these. I did this one. I'm going to do one in German in December. And we have a class that we are going to do, I think we said on January 31st. And these are your times, 1:30 to 9. For me, it's going to be 7 in the morning, 7:30. So I'll be getting up with coffee doing this with you guys. And in this class, it's we're going to teach you more about energy manual therapy. We're going to teach you evaluation because I think it's important to know how to measure the change. We're going to teach you 2 biofeedback techniques, and so you can dialogue with the body. And we're going to give you a protocol, and we're going to teach you how you can work on yourself more specifically, but also work on other people. And when you're finished this, you're going to have enough tools to make changes like we made today. And you can do them on yourself, friends, family, whoever. This class is open to anyone. You don't have to be a body talker. You don't have to be a professional, in medical field. Anybody can do this. I'll tell you a funny story. During COVID, when I was teaching a lot of this, and a lot of my patients wanted to be treated online. And this one guy, he's 94 years old. He writes children's stories, and he loved this technique. We're still, I still see him once a week, but he doesn't really need it. It's kind of like he just likes to talk to me, and we just exchange things. But he wanted to learn it, and I was able to teach him within the hour. And I did a self-evaluation, and he treated me, and he was successful. So anybody can do this. Okay, if you want to um, follow me a little bit or find out more about me, you can take a picture of this. These are my website, Facebook, Instagram, and all that. And that's my clinic address and my email. If you want to connect with me, if you have more questions, I have a new website that Dr. Kerry D, but we're still working on it, so it's still in its infancy. And I think that's it. And I think Florence will probably reach out to you, and we'll get a copy of this tape. And if you want to watch it again, you can. And we'll send you a video and a PDF of the little self-treatment we did, and you can do that. You can give it to friends and family or use it on your patients, whatever you want. You're welcome to use that. And once we do the class in December, and you can come back and sit in that if you want, we're going to do it English and German. And then we'll see what the level of interest is, and we'll do a class in January. And if the interest is still there, then we plan on doing some of the other classes. And if we have a good interest, I also go to Romania and Poland to do these classes as well. I just got back from Poland about a month ago, and we did this class there. It was so much fun. I had all these osteopaths that are used to working with the physical body, and they're all like this, the first day. But we just started to, we had some incredible changes, because there you can feel people's organs, you can feel their ribs. It's not like doing this online where we have to go with posture and range of motion. I can get in there and I can feel your spine. I can feel your ribs. I want to assess your range of motion. And I invite other students to come up and feel it. And they're amazed that I never touched the person, just working with their energetic holograms. We were able to make, these changes. Does anyone have any questions at all? Anyone have any confusion or questions? And Florence, I wanted to thank you. We kind of threw this together at the last minute. So, and you can see we're getting some of the kinks out doing this live. Oh, good. You got the spotlight perfect this time. All right. So when we do this in December, it'll flow really beautifully. But thank you for having me. this is something I did not plan on doing this work because I love manual therapy. I love putting my hands on people and working it. Uh, but when I look back, it was beautiful meeting John and getting exposed to BodyTalk and now this, and I love this. This is definitely one of my passions, and it's not that I don't do manual therapy anymore. I kind of combine the two together. I believe you still need to coach people. I look at people. I'll finish with one thing, like they're a triangle. So if you think of a triangle or a pyramid, you have four levels. When people come in that could be at level one, they could be in constant pain. And there's certain things that we can do there. In level two, you're like a roller coaster. The pain's only there when you do certain movements. In level three, there's no more pain, but you're deconditioned. So they need strength and endurance and flexibility. And then four is maintenance. So when people come in pain, people always want to know, well, how long is this going to take? I said, well, all we're trying to do is get you out of pain and get you here, get you to the next level where it's periodic. And I find this very easy to dialogue this with the body. And once you're here, we get you into this part. And then once you're in here, then we get you into maintenance. This is where I want to get people to in maintenance. And then once they are, um, having no pain or that, then we just keep them there. So I see a lot of people once a month, once every 2 months, just to keep them going, with us. Okay. And no other questions? Melissa has a question. Go ahead, Melissa. You got to unmute yourself.
Sorry about that.
That's all right.
I didn't see a price for that class.
Oh yeah, well, I have it in US dollars. She still has to translate it into euros and German francs. In the US, it's 350 for the day. Early bird's 300. So she'll translate that into whatever your local currency is. That's what it is roughly for the day. And it's probably, I would say, with breaks, and it's probably like a 7-hour day. It all depends on, translation and also, making sure everybody understands things. It all depends on, I'll stay there till the end and longer if people have questions. So, but we usually about 7 hours.
So I understand that's with the German is there also a class without German translation soon?
You mean a foundation class?
Yeah. Mm-hmm.
Well, I definitely will have them without it. The one that we're going to do for Florence there will probably have German translation. And usually it's not, I actually don't mind. I just did one in Romania and I did one in Tokyo. It only adds a little bit more time. I actually like it because it slows me down. I actually have to think before I speak. And I like the process. It also gives a student time to take notes and to think about things. So it's not, coming at you, taking a drink from a fire hose, they say. So it's not as disruptive as you would think. I've been doing it for years and it works out well. But if it's something that's an issue for you, you just let me know. And if there's enough people, we can always do one just English only. That's not a problem. All right. Any other questions? And some of you, I was talking to Florence, good friend of mine, Tracy Clark, will be teaching in January as well. She'll be teaching, it's module 5, is it?
It's 5A, the new
5A.
Physiology and Anatomy.
Yeah, so that's actually if you're thinking of doing that, that's an excellent class to do, and that will help you with kind of what we're doing afterwards. So it's kind of nice that mine's kind of following hers. So they'll blend in together. You can use all the information you had from the anatomy to work with the energetic hologram. So I found out about that, and that's fine, blending those two together. All right.
There was one more question in the chat from Marika.
Okay.
Is it the IBA course?
Okay, yes, not the foundation. The foundation course is a 1-day class, and I decided to do that because there were so many people out there that didn't want to make the commitment for each of those classes are like 3 days long, like full time, and some people didn't want to make that kind of a commitment. So I started teaching this foundation class probably about 2 years ago, and it's worked out really well. Then people can take and they go, it's not my cup of tea, and that's fine. Or people go, wow, I want more. That's great. So now you know. So this class is open to anyone. You don't have to have body talk or fundamentals or anything. Anybody can take this. Now, in order to get to the next level, it'll be body talkers and non-body talkers, but it will be on the Body Talk website. Okay.
And the next level, you don't need the foundation class. You can also do directly the next level or not?
Yes, and you do
Yeah.
not need body talk to take any of these classes. When I developed these, John Veltime was actually in my first class, and he was actually, I think you can watch it on YouTube still, when I treated John at the time. So he gave it his blessing. He goes, it's a standalone technique, but I always acknowledge body talk in it. I'm not trying to teach body talk or anything else. It's a totally different thing, but I'm going to show you how you can incorporate it in with body talk. All right, Melissa again.
Sorry. I just noticed something because I worked on my shoulders, and now literally just now I feel that my spine is really changing and starting to hurt. Is that common, normal? That
Well,
you-
three
you-
things can happen as a result of treatment. First of all, in this class, you're just picking an area of tension. The area that you decided to pick may not be the place you should be working on. In the foundations class, we teach you how to dialogue with your body to find out, where's the best place. So for example, let's say you had shoulder pain. Well, that may not be the best place to balance. And when we go to use the protocol may say, oh, you need to balance this region at the back. And when you do that, all of a sudden the shoulder releases. Sometimes when you work on an area, it's not the cause, it's more of an effect. Sometimes it can flare up a little bit. And we get into more detail on that. But three things can happen as a result of treatment. A, I don't feel any different. I don't like that. But you could also feel better, which I like, but you can also feel a little bit worse. And what the worse means is that it's like when you clean the attic, you get some dust, right? It's kind of like a little bit of a healing reaction. You start to open some things up, and then you start to get a release of energy, blood flow, venous drainage, lymphatic drainage. There's all sorts of certain things that are occurring in the body. Okay, but this is something she's going to send you the video, but I would practice it. And when you take the foundation, or if you do body talk now, you can just tune into your body and find out, well, where's the best place for me to work? It's not always the area of tension. We use that now because not everybody has the resources now to, find priority. Okay. All right. Any other questions? All right. I've got to get back to work. You guys are evening time, right? You guys are going
We
to
need
bed.
to go to bed.
I know. Well, thank you guys
Thank you.
for listening, and
Thank you.
we'll do this again.
Thank you very much,
this
Kerry,
summer.
and thank you very much for your time and your passion. I think we all want to have end of January already, but there's Christmas in between, so we'll be patient. And yeah, I will, as Kerry said, I will send you things in the next couple of days, and I would also put together a flyer for this class of the end of January, where you have everything, where you register, the price, and all this.
Okay, perfect.
So,
All right.
and if you have questions, just ask me, write to me.
Yep, and you can
Thank you
also
very
send them
much.
to me, and you know how to contact me if you have questions. All right. Have a good evening. Thank you.
Mhm.
Bye-bye.
Thank you.